Hi, my name is Diane Wilcox. I'm a nurse practitioner from the University of Connecticut Health Center. I care for people with chronic obstructive pulmonary disease, or COPD. This module will provide the non-licensed healthcare team member with important information on the best ways to care for people with COPD. First, what is COPD? COPD stands for chronic, which means long-term, obstructive, meaning blocked, pulmonary, referring to the lungs, and disease, which means sickness. You may also hear COPD called chronic bronchitis or emphysema. COPD is a lung disease that makes it hard to breathe, especially with activities like walking, climbing stairs, or even everyday activities like bathing. COPD is a lifelong disease that can worsen over time, but the good news is that there are medicines and other therapies that can make symptoms of COPD, such as shortness of breath, better and allow your patient to lead a happy and active life.
When I was first diagnosed, I was scared to death. I thought I was going to die. And this changed my way of thinking. And, there's other people out there that, have the same condition and, you're not going to die.
What happens with COPD? The air passageways, or the tubes in the lungs, become smaller. This happens because the passageways become swollen and may also be blocked with mucus. Air can get trapped in the air sacs of the lungs, like an overfilled balloon. The air sacs become damaged and no longer work. Finally, the air we breathe cannot get into the bloodstream. How might your patient with COPD feel? At times, your patient may feel like it's hard to breathe, especially with activities like walking, climbing stairs, and again, like bathing. You might hear them wheeze, which is a whistling sound heard when they breathe. They may also cough, and they may feel very tired, especially after activities.
I'd go down in the basement to wash a tub of clothes and come up, and I'd have to sit on the couch the rest of the day because I was too tired to do anything.
Sometimes COPD gets worse. This is called a COPD exacerbation or flare-up. A COPD exacerbation requires immediate attention. Your patient may develop a new cough or worsening of their everyday cough. They may be coughing more mucus, report that it's thicker, or that it's changed in color. They may also feel that it's difficult coughing up the mucus. They may be unable to do their usual activities because they find it too hard to breathe. They may be more tired and feel more anxious. What does a person with COPD look like? Generally, they are older. They may have smoked for many years. They may have a chronic cough with mucus production, and they are short of breath. Their shortness of breath worsens over time. It's worse with exercise, and it also becomes worse if they have a respiratory infection.
It's been quite a number of years since I was diagnosed with COPD. I realized early in the game that there was something wrong. I knew I was prone to a lot of respiratory illnesses sometime, and it seemed I had bronchitis, colds every couple of months, and I realized I was having a cold about every 3 months or so, and myself, I knew that something was not right, and I went to the doctor. After a series of tests and whatnot, we came to realize it was COPD.
COPD is a big health problem in the United States. Over 12 million people in the U.S. have been diagnosed with COPD, and it's estimated that another 12 million people have COPD and don't know it. It's the third leading cause of death. It's the fourth leading cause for why your patient may be admitted to the hospital, and the third leading cause of why your patient may need to be readmitted to the hospital. In summary, COPD causes your patient to be short of breath. Although it's a chronic, lifelong condition, it is treatable. Now that you've learned about COPD, you can help your patient live better with COPD. This module will provide the non-licensed healthcare team member with 6 important steps that help keep patients with COPD well and out of the hospital. Make sure that you comply with your state's licensure regulations and scope of practice guidelines. Step 1. Stop smoking. Why is it important to stop smoking? Smoking is the #1 cause of COPD. Smoking harms the body, but especially the lungs. Smoking will make COPD symptoms worse. The best thing to do to help COPD symptoms is to stop smoking.
I was a smoker for 45 years, and even knowing how bad it was for me, I was very dependent upon it. It wasn't easy. It was the hardest thing I've ever done in my life. And for me, who truly felt that I must be so addicted to cigarettes that I could not quit, I did.
Step 2. Symptoms and Action Plan. Step 2 will help you recognize the symptoms of COPD and what you can do to help. This is the COPD Zones and Action Plan. Your patient may have information about COPD zones and the action plan. The COPD zones can tell you what type of breathing day your patient is having and what action your patient should take in each zone. The green zone is a good breathing day. Your patient should continue to take their everyday inhalers and continue with regular exercise. The yellow zone is a bad breathing day. Your patient should continue to take everyday inhalers, but may also need to use their rescue inhaler or rescue medicine in their nebulizer. And most importantly, to call their doctor or nurse to report their symptoms. The red zone is an emergency breathing day. You should report these symptoms to the nurse immediately. If your patient is at home, they need to call 911 and go to the emergency room.
Keep that chart in my bedroom, and it's in that little top drawer with the rest of my medications. And it reminds me that, when I'm having my good days, which are the green, maybe the beginning of maybe a not so good day with the yellow. Well, I definitely don't want to go to the red, I don't want it to even get to that point.
So what symptoms should you report? More coughing, wheezing, or difficulty breathing. Your patient complaining that they have chest tightness. The cough has increased mucus that is thick and difficult for the patient to cough up. Maybe there's a change in their vital signs. They may not be able to complete their everyday tasks. They may be in bed and more tired. You may notice that they're more restless, anxious, and maybe even confused. As a certified nursing assistant or nurse's aide, you spend a lot of time with patients. It's important for you to tell the nurse right away if you notice changes in your patient's symptoms or behavior. Here's an example. Myrna is a 75-year-old. Normally she has some trouble breathing, but she is able to walk around and do her own activities of daily living. Today, the door to the house was left open when you arrived and unlocked. She was too weak to get out of bed. She's been coughing more, and her mucus has turned green. What should you do? A. Wait until tomorrow to report her symptoms because she might feel better. B. Let the patient tell her daughter later. C. Don't call anyone because the patient asked you not to. Or D. Update your nurse right away with these changes. The answer is D. You should always update the nurse with changes in how your patient feels, especially if there's a change from their usual functioning. Step 3. Medicines. Medications for COPD help your patient to feel better. Patients should take their medicines even when they feel well, and patients who take their medications as prescribed feel better and spend less time in the hospital. It's important also to encourage your patient to keep a list of their most current medications, including the over-the-counter medications. They should also bring that list with them to each doctor appointment. There are many different types of medications for COPD. An inhaler is a handheld device that delivers medication into the lungs as your patient breathes it in. A nebulizer is a machine used to administer a liquid medication that is made into a mist and then inhaled through a mouthpiece or mask. There may be some pills that a patient may take by mouth to help control their COPD symptoms as well. Oxygen should be considered a medication. It should be handled properly. Never adjust your patient's oxygen levels. Only licensed healthcare workers are authorized to administer oxygen. If your patient is having trouble managing their oxygen, notify the nurse or have them contact their O2 vendor. Some general do's and don'ts: keep oxygen away from heat and direct sunlight. Turn oxygen off when not in use. Never smoke near oxygen. Never have an open flame, such as a gas stove, fireplace, candles, or a cigarette or cigar near oxygen. And don't use petroleum-based products in the nose. Some additional tips on what to report to the nurse. If you notice that your patient tells you they are having difficulty using their inhaler medications, please notify the nurse. If your patient says they can't afford their medications, has difficulty getting to the drugstore to pick up their medications, or doesn't understand the directions on the medications, those are important things to report. Step 4. Doctor appointments. It's important that your patient go to all their doctor's appointments, even when they are feeling well, and especially if they don't feel well. Patients with COPD who go to their doctor's appointments stay well and out of the hospital.
Well, you know what? I never miss my appointments. Oh, not my pulmonary appointment, because that's the one that keeps me breathing. But even if I felt good, and I know in the back of your mind you might say, oh, I feel good, I'm not going to go to that doctor on that doctor's visit. But I would strongly suggest that, to to go, whether you're feeling good or not, because you're going to learn something.
Step 5. Exercise and activity. Specific activity levels may be determined by your patient's doctor. However, exercise is generally safe and helpful for patients with COPD. Pulmonary rehab is a safe way for patients to get exercise. Pulmonary rehab is an outpatient program specifically for patients with COPD. They learn how to exercise and get stronger, how to control their shortness of breath. They learn more about COPD, and finally, how to use their medications to help them feel better. Here are some examples of exercise that is considered safe for people with COPD. Walking, dancing, swimming, sex, cleaning, cooking, yard work, lifting light weights, and regular activities of daily living.
I do try to get as much exercise as I can, and I do walk. I realize, what I really do is I walk in place. Sometimes the weather doesn't permit to go outside, but I'll walk in place for about 20, 30 minutes if I can get up to that speed.
Breathing techniques. You may see your patient using different breathing techniques to make their breathing easier. Patients may use these techniques every day when feeling anxious or short of breath.
The pursed lip breathing, where you breathe in through your nose and out through your mouth, you catch yourself before you start panicking and going, it helps a lot.
One example is pursed lip breathing.
Pursed lip breathing is very important for people with lung disease. It helps get the air out of your lungs. You want to breathe in and blow out 4 times as long as you breathe in. The best way to do it is to be in a chair with a back or your back supported in bed or with pillows at night. The more you repeat it, the more you practice, the better you'll be at it. You want to breathe in through your nose and blow out through pursed lips, 3 to 4 times longer than you breathe in. You're going to use your diaphragm, which is the most important muscle for breathing. Put your hands on your belly. Breathe in through your nose, blow out through pursed lips. As you breathe in, your belly should rise. And as you exhale, your belly should fall. You don't want to use your upper body and your shoulders, but you want to work on the belly breathing, the diaphragmatic breathing. Pursed lip breathing should be used all the time, including during exercise.
Another example is rescue breathing.
Rescue breathing can be used for times when you're short of breath or when you're doing an activity that makes you short of breath. The purpose of rescue breathing is to elongate your chest, have your belly drop out of the way with gravity so you can take a deeper breath. Then you need to use your pursed lip breathing. Breathe in through your nose, blow out through pursed lips. Make sure that your blowout is longer than your breathe in until you regain control of your breathing. Breathe in through your nose, blow out through pursed lips. The chair is supporting my chest so I can breathe easier. You can also use the counter in your kitchen, or you can put your arms up against the wall when you're out in public, just to catch your breathing.
You can help your patient to pace their activities and make those activities easier for them. Because you help your patients pace themselves and conserve their energy, they have enough energy left over for the enjoyable things in life. Some examples of ways you can help: have your patients sit down when doing activities like brushing their teeth or showering. Keep most of their toiletry items in arm's reach and at waist level so that they are not reaching above their head or bending below. Also, taking breaks in between activities.
If I start, I just stop and I just catch my breath and then I continue going, or like even the dishes. Sometimes if there's a lot of dishes, I'll, work it gets me to where I'm breathing, fast. So I'll just let the dishes air dry. I'll go sit down, watch Days of Our Lives. And then after that's done, I'll come back and I'll finish drying the dishes and put them away. And then I'm fine.
In summary, staying active helps your patient breathe better. Breathing techniques can help your patient breathe easier. Saving energy will help your patient stay well and stay out of the hospital.
And being in the hospital wasn't too much fun, and it, affected a lot of things. And since I've been doing this, I haven't been in the hospital in 3 years. So I live in fear of ending up in the hospital, so that's why it's become my job. My job is to keep myself healthy and out of the hospital.
Step 6, tips for healthy living. The following are tips for keeping your patient with COPD healthy and out of the hospital. Pay attention to your patient's emotional health. Patients with COPD can commonly feel anxious or depressed. If you notice a change in your patient's emotional health, just feeling worried, nervous, or sad, these are things that you should report to the nurse right away. Eating is important for patients with COPD, and a healthy diet helps them stay healthy as well. It's easier for your patients to breathe if they eat smaller meals more often throughout the day. It may be beneficial to avoid dairy products as they may produce more gas or increase their mucus. Also, it's important to stay at a healthy weight.
You try to eat well. I think a healthy diet really helps a lot. I notice when I eat better, I feel better.
Eat several times a day rather than 3 big hefty meals, and I found that, and also as I've gotten a little older, that I can't eat quite as much, but it's also true with the COPD, your stomach sort of, and your lungs and everything sort of expands, and you just can't take in as much food because you feel very full and uncomfortable.
Avoiding illness. It's important for both healthcare team members like you and patients to get their flu shot every year. Everyone should wash their hands often and keep your hands away from your face. Sneezing and coughing into your elbow instead of your hands is helpful. Also, avoid those who are sick. But most important, as a healthcare team member, if you are sick, stay home.
I always wash my hands. What do they say, germophobic? I think I am. I think you get to be when you have COPD. I make sure I get all of my shots, my flu shots every year. I even get a pneumonia shot. And just try to stay healthy, eat right, be with family and friends, loved ones. That helps a lot. And then just have faith that everything is going to be all right. I have a very good faith.
In these Long Talk video series, we've learned that COPD is a lifelong and treatable illness. In summary, patients who follow the 6 steps that we have discussed will stay well and out of the hospital.
I've never been in the hospital for my COPD, so I want to keep it that way, and I think maybe this is the way to do it.
Get to know your patients. Know their symptoms, their emotions, their behaviors. If anything is different, report those changes to your nurse. Thank you for your attention.